surface which we would call as loose body. So these are the loose bodies. So the fragmented portion would go around the synovial joint. Okay, this would cause the further erosion of the articular cartilage, leading to a polished surface, which we would call as the bone hibernation. Okay, so yun yung magiging nangyari. Okay. Next would be 196. So 196 is rheumatoid arthritis. So if osteoarthritis, the pathogens would be the friction as well as the presence of loose joints causing the bone inflammation. Here there would be the presence of arthritogenic antigens, to which studies have found inconclusive evidence that viral infections would cause it. Okay? So what we know is that because of the arthritogenic antigen, it causes an autoimmune reaction that will lead to the inflammatory condition that we would see in rheumatoid arthritis. So this is the surface. You can see the presence of granulation tissue formation. You have mononuclear cell infiltrates in the form of histiocytes, lymphocytes, few neutrophils. You have proliferating blood vessels. And then contributing to the problem would be the presence of fibrocellular masses in this one, which is like a polyp which is a fibrocellular mass containing fibrosis and mononuclear cell infiltrates. So this is called as PANUS. So PANUS would be characteristic for rheumatoid arthritis. So if you have the loose bodies in osteoarthritis, you have the PANUS in rheumatoid arthritis. Loose bodies of osteoarthritis. So another common joint disease would be the presence of gout. So you have monosodium urate crystal aggregates, which we would call as tophi. Okay? So aggregation of monosodium urate crystals. So the predisposing factor here would be the presence of hyperuricemia. Okay? But not all persons with hyperuricemia would develop gout. Okay? So it would depend on genetic predisposition. It would depend on any deficiency to the enzyme like HDPRT, enzyme deficiency, a problem with excretion and breakdown of the uric acid. Okay, so here there would be the hyperuricemia would be one of the problems. Okay, we have saturation or oversaturation of such crystals. They would then be deposited in different parts of the body, particularly in the joint spaces. So, clinically, the patients would observe morning toe sickness, okay? Yung morning toe nila inflamed. Okay? So that's a common experience among those with gouty arthritis. I think there's one more slide in with rheumatoid arthritis, that's slide 84. Okay. Encounter nyo yung slide 84. That's the formation of the rheumatoid nodule, showing the presence of granuloma with fibrinoid necrosis in the center. Okay. That's the one that we often encounter in persons with no juice in the joint, in the fingers, okay, and on the toes, the rheumatoid no juice. Okay, we go to the soft tissue. Okay. Number one is fibrosarcoma. Fibrosarcoma is originally coming from the fibrous tissue. 22. Okay, so what is the characteristic pattern for herringbone? For herringbone, for fibrocytes, it's herringbone. Here, dapat na. Yan, yan, yan. Actually, for this slide, it's a mixture of a storyform pattern, okay, and the herringbone. Okay, yung herringbone, say parang nagle-letter D sila, okay, they are in palisade form. Storyform pattern, whirling formation. Marami ng mga yan na whirling. Herringbone pattern. Marami yung whirling. So, herringbone. Here. Okay, so fibrosarcoma can be low grade or high grade. It depends on the appearance of the spindle shaped nucleus. Okay, so if they appear like this one, this is a low grade fibrosarcoma. Wherein if you look at them on a low power view, they're fairly uniform. But for fibrosarcoma that's high grade, they have pleomorphism. Next is slide 23. Bago kayo umalis ng second year, ano to? Yan. Nerve yan. Nerve yan. Baka mamaya biglang okay. Okay, so this is rhabdomyosarcoma. So it's originally coming from the skeletal muscle. Okay, so it's important that you identify it properly because you also have a smooth muscle tumor, which is the leiomyosarcoma. So in leiomyosarcoma, you have interlacing fascicles of smooth muscle fibers. Okay, when you say interlacing, you have an alternating pattern of longitudinal and circular. Longitudinal and circular. So and that would be applicable for both malignant and benign condition. Okay, the difference would lie in the nucleus. Okay, for rhabdomyosarcoma, you have several variants. The most common that we encounter would be this one, which is a pleomorphic form. Okay, so in the pleomorphic form, you have the bizarre nuclear formation. Okay. So you can see here that some of the giant cells. This is a cell containing a very large nucleus with regularity of the nuclear outline. This is also a bizarre nuclear form. Although it's spindle, it's better appreciated because the rhabdomyosarcoma are naturally spindle cell forms. okay, not from the neoplasm, unless you would be thinking of the sarcoidosis, sarcoma botryoides. Okay, sarcoma botryoides would be common in the infants. Okay. This is like 25. Liposarcoma. Okay, so you can see here that this one is the normal. Okay, we have the rounded, okay, adipocytes where barely conspicuous nucleus. Barely conspicuous nucleus. So you can see a few cells possessing the nucleus. Okay. Some of them are very uh, they have very minimal nuclear decay. Okay. So that should be the normal appearance of the adipocyte. Okay, you have very large cytoplasmic content, very small. Anything bigger than this one is seen as an atypical form. Okay. We look at the other areas. And here you have different forms of the fat, okay, or the adipocyte. To notice the difference between the nuclei, okay, the one normal oocyte. You have here larger, okay, larger nuclei. Although if you are going to compare this nucleus to the previous one, okay, you can already say that in rhabdomyosarcoma, it's really malignant. Okay, here you will be having a second thought, okay, whether this is going to be a malignant one or not. But basing on the appearance of the cell, you have a you have an adipocyte, okay, containing a typical nucleus. So that would make you diagnose this one as a liposarcoma. Liposarcoma is composed of typical lipoblast that contains atypia in the nucleus, and very important is you have an abundant clear cytoplasm. If you do not have that clear cytoplasm, then you would not be thinking of a liposarcoma. You would be thinking of something else, like fibrosarcoma or anything. So liposarcoma, rhabdomyosarcoma, fibrosarcoma, these are malignant tumors that can be seen anywhere. Okay? As long as there's a soft tissue component in that part of the organ. So, pwede natin siya makita sa lungs. Although they are rarely seen, we can see them common in the retroperitoneal area. We can also see them most commonly in the extremities. Sa thigh, uterus. So you can differentiate it from the bone tumors through X-ray. And of course, with the help of your pathologist. Okay. Okay, so that's the last one. Okay. Be prepared for the